Yes, you welcome to my channel. This is your boy Jacob. Now today we are going to talk about the services provided by a health center for in Uganda and each and everything you expect at a health center for here in Uganda. We are going to talk about here in this tutorial. So if you are new to this channel of mine, just consider subscribing to my channel by clicking on that red button right there in the corner. Don't hesitate to click a thumbs up if you enjoy my tutorial and make a comment right there in the comment section. Now, a health center for here in Uganda is at a county level. That's a step above a health center 3, which is at a sub-county level. A health center 4 is at a county level, and it has staff almost twice what a health center 3 has. Why? Because they provide more services to the people than what a health center 3 provides. Now, a health center 4 is headed by a medical officer. They also have a number of staffs on their unit. They have clinical officers who run the outpatients. They have a number of nurses. They have midwives. They have labs. They have record assistants. They have many staffs on their team to manage the unit. Yeah, because that's a big unit at the county level. So they provide more services than what other centers provide. They provide outpatient services like the health center 3. What's different with the health center 4? They do admissions, both inpatient for male and women. On top of that, on top of that, another service they provide, which these lower centers don't provide, is they have an operating theater. Yes, health center 4 has an operating theater, and they do all operations, especially cesarean sections, minor operations like hernias, STSs, those operations which a medical officer can manage. But most of the operations being done in their theater are obstetrical emergencies like cesarean sections. They are carried out at a health center 4 here in Uganda. On top of that, they carry out all these other services these other centers do, like immunizations, family planning, health education, outreaches, all those other services the lower centers do. A health center 4 does them more at a larger scale. They receive their funding from the government. They have the PHC funds which come almost every 3 months. Now the PHC funds help this hospital run their services, especially outreaches, playing VHTs, and all those support staffs who are their hospital, who are not under payment, but they are providing services to the hospital. They are paid on PHC funds. On top of that, these funds help with things like fueling their cars, fueling their motorcycles, all those things which help the hospital, the facility run. They run them on PHC funds. So most of the maintenances on the hospital and all those other things, they have to wait for PHC funds. Those are the funds which are given to run the hospital. So all those services which cannot be managed at a health center, for all those patients who cannot be managed at a health center for, they are referred to a general hospital or a national referral hospital or a regional referral hospital. In case a patient needs a specialist and cannot be managed by a medical officer at a health center for, they are referred to a regional referral hospital. So basically that's what a health center for provides for a county level. Yes, that is a brief tutorial on services provided by health center for. If there's anything I've left out and you want to comment it here on my tutorial, don't hesitate to make it right there in the comment section.